right, today's workout is going to focus on core. So what we're going to do is we're going to work 3 planes of motion, and we're going to do 7 different exercises. A couple pieces of equipment that you might need will be a yoga block or something that's approximately 2.5 to 3 inches high. Also some TheraBand. This is black TheraBand, so it's probably the most intense TheraBand that you can pick up. And a hip band, hip circle, power band, whatever they call this. So the first exercise we're going to do, we're going to work on rotational core. You're going to attach your TheraBand to a telepost or in the doorway, and you're going to kneel. I want you to squeeze your glutes, and taking the TheraBand around your shoulder, you're going to rotate. And the real work is where you are returning back to neutral, okay? Toes are pushed into the floor, core is nice and tight, and you're going to rotate and then return into a slight bit of extension. Breathing throughout that range. Now, if you're not finding this challenging, you may be flexing your hips and just allowing your body to kind of move through that range with assistance. So I want you to kind of focus on making sure that your glutes stay tight and the motion's coming through that core. All right, the next exercise we're gonna do is a double arm drop down. So you're still gonna use that TheraBand. It's gonna be attached fairly low. You're gonna bring yourself away so that you've got enough tension. And I want you to bring those arms to the side, and you're gonna lift your legs up, okay? And you're gonna keep your core nice and tight, and you're gonna drop your heels to the floor, and then you're gonna reach overhead, pulling down and dropping. Neutral spine the whole time. Return the arms overhead. So in this situation, I'm gonna find that that's not enough tension, and you're gonna just drop. Good. Now we're gonna work 12 to 15 reps on that next exercise. Moving to a side bridge. So when you're setting yourself up for the side bridge, make sure your elbow is directly underneath your shoulder, bent at 90 degrees. We're gonna do a modified side bridge, so in a bent knee position. Your hips are at about 45 degrees. So you're gonna bring yourself up into the bridge, making sure your pelvis stays neutral, and you're gonna kick that leg out, drop it down, lift it up, and bring it back, and return back to the hip hinge. So coming up, kick it out, drop it down, good, and then coming back. Doing 8 to 10 reps on each side with that exercise, making sure that you repeat on both sides. Next exercise we're gonna do is plank drop. So with this exercise, we're working on rotational core control and some static endurance. So you're gonna set yourself up into your plank. We're gonna go from elbows. So a knee and elbow plank. Your toes are gonna be flat to the ground or tucked in, whichever feels more comfortable. And in this position, I want you to take a deep breath in, blow it out, pull your belly button towards your spine, and you're gonna alternately extend the knee without rocking the pelvis. If you're not finding this challenging, you can start in the up position and just tap the knee down. Okay, we're gonna go 15 to 20 reps total on that exercise. The next exercise is the 4-point skater position. And again, this is working on static control of the lumbar spine, as well as moving into flexion, extension, and abduction of the leg. So leg is up to the side. You're gonna set yourself up in a 4-point position, neutraling out your body. So pulling in your core, screwing your hands into the floor. And in this position, that toe is tucked under on this side, back is flat. And you're gonna work on just lifting that leg off the block. Now the key is not to twist your body as you go through this range. Good. Repeating 8 to 12 reps on each side with that exercise. We're gonna do the next exercise, a little bit of a sit up. We're gonna go into some back extension. using a little bit of shoulders. So I'm going to be facing this way. You're going to use that same TheraBand, wrapping around so it's equally tight on both sides. Good. We're going to go down into our sit-up, and we're going to bring the arms there. Using the band to assist you, coming up if you need. Heels are pressed into the floor. Peeling yourself off the floor and lowering yourself controllably. 12 to 15 reps with that one. And the last exercise we're going to do is we're going to do a sit-up chop. Okay, so we're going to work our oblique abdominals in that rotational plane. So you're going to start the exercise with your feet planted on the floor. Hands are at your side. You're going to lean back slightly, and we're going to go into a little chop. So just a small extension and rotation. Okay, keeping that core neutral. Good, and repeating that 8 to 10 reps on each side or to fatigue. Last exercise you're going to do, sorry, I'm adding one more, is the bend hip bridge. You can use the TheraBand, and this can be done without. Placed around your knees, just above your knees. On your back. Keeping a neutral spine. Feet are about hips width apart. Hands are at your side. You're going to bridge up. And in this position, I'm going to have you kick out that leg. Try to control that core so you're not getting a twist. That glute stays on. Toe comes towards the shin. Good. So rather than staying in that upward position, I'm going to have you kick, hip hinge down. Coming back up, kick,